Namaste friends, welcome to Bano Biology Center for True Learning. I request you to subscribe our YouTube channel Bano Biology Center for more videos and press the bell icon for latest notifications and updates. In this video, we are going to learn the new concept infertility. Let us begin the concept with the meaning of infertility. Here, I am presenting the definition from the NCERT textbook. Inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility. In simple manner, I explain you. There is a couple. They have been participating in sexual intercourse or coitus for 2 years of time, but they are unable to produce offsprings or children. That condition is called infertility. There is other simple definition is given here. Inability of a person to produce by natural means. Even couple have sexual intercourse without taking any precautions. They are unable to produce offsprings. That condition is referred to as infertility. What are the reasons of infertility? The first reason is physical reasons. Second, congenital reasons. Third one, some type of diseases. Fourth one, taking of some kind of drugs. Fifth one, immunological reasons. The sixth one, physiological reasons. Here I am trying to put forth about each and every reason in detail. The first reasons causes for infertility in couple are physical reasons. Here some of the physical reasons are mentioned. One is dietary habits of the person. Today the major problem is obesity. Because of the improper diet, the people get overweight. Because of that reason also they are unable to conceive. Another reason is smoking. Too much of smoking so lapses the body mechanism. Another one is alcohol consumption. The alcohol consumption on overdose also causes infertility in both men and female. The second reason for infertility are congenital reasons. Here congenital means the problems occurred in the baby before delivery. During the fetal development itself, some of the problems occurred in the mother's womb. Some of them are mentioned here. Tubal abnormalities. Here the fallopian tubes didn't develop properly. There is a problem. Then absence of vas difference. In case of males, vas differences or long ducts are completely absent. Then congenital uterine anomaly. Uterine anomaly means here abnormal structural deviations happen to the uterus of the female. These are few important congenital reasons causes infertility in men and women. Another reason, diseases. Some kind of diseases leads to the condition infertility. Already we have discussion about sexually transmitted diseases in previous videos like genital warts, genital herpes, HIV infection, gonorrhea, trichomoniasis, like that. These are the diseases causes infertility. Other reasons are drugs. Some chemicals enter into the body, enable the people's reproductive organs functioning in proper way. Here some of them are mentioned. One is marijuana, steroids influence the sperm count. It reduces the sperm count in men. Another one is cocaine. Cocaine influence the reproductive functioning of the female. Another reason is immunological reason. These are the reasons related to the immune system of the person. Mainly we talk about anti-sperm antibodies. Dear friends, so it is very important point, so listen carefully. Anti-sperm antibodies are produced in both male and female. It is not occurs in general. In specific cases only they are producing the bodies. For example, there is a problem, there is a infection with the prostate gland or any other parts of the reproductive tract. The blood will bleeds. When sperms come in contact with that type of blood, automatically this type of anti-sperm antibodies, shortly ASA, are released into the blood. It causes the killing of the sperms also. Here I try to give some information of anti-sperm antibodies. They cause the infertility in both male and female. ASA are immunoglobulins of immunoglobulin Z, immunoglobulin A, and immunoglobulin M. Actually, they are directed against sperm antigen. They fight the sperms. They keep on trying to destroy the sperms or kill the sperms. They mainly interfere with the motility of the sperm and transport through female vaginal tract. They also inhibiting the capacitation and acrosome reaction of the sperms. Another regions are physiological regions. Here the physiological regions are concerned with the body functions. Let us see what are they. The first one is hormonal problems. Imbalance in the secretion of hormones leads to the infertility, like failure to produce mature eggs due to the improper releasing of the gonadotropin releasing hormone, then follicle stimulating hormone, then luteinizing hormone. And also malfunctioning of the hypothalamus and malfunctioning of the pituitary gland also leads to the infertility. The second reason is scarred ovaries, means physically damage occurs to the ovaries, refers to as scarred ovaries. In such case also ovaries unable to produce the egg. Another reason is premature menopause. Menopause means the permanent stoppage of the menses in females after the age of 50. But in some females, the menopause occurs below 40 years of age. That condition referred to as premature menopause. It also leads to the infertility. The another reason is follicle problems. Here, unruptured follicle syndrome. Follicles have been developed. The secondary oocyte present in the Graafian follicle, but rupturing of the Graafian follicle do not takes place. In that case also infertility problem occurs. Another reason is polycystic ovary syndrome. There's some kind of cysts are formed in the ovaries, causes not releasing of the egg. Another reasons are thyroid problems. Some other problem is endometriosis. Already we came across this word. Endometriosis is nothing but the growing of additional tissue external to the uterus of the female. Another reason is abnormal sperms. Structurally and functionally, the formed sperms are not in proper manner. Another reason is lack of sperm count. There should be a required sperm count to meet the task of fertilization. The lack of sperm count leads to the unfertilization. By that leads to the infertility. Risk of both tubectomy and vasectomy. They are not reversible. So once sterilization process proceeded, the releasing of the gametes won't take place. Another reason is hypogonadism. What is hypogonadism? The low androgen levels, low testosterone levels in the blood called hypogonadism. They diminish the level of sex hormones. Hypogonadism diminish the levels of sex hormones. When sex hormones are not in a right quantity, the infertility problem automatically occurs. It is about the reasons of infertility. Next important aspect, assisted reproductive technology, ART. So you can have one question in your mind: can infertility problem treats? Yes, the infertility problem of a couple can be treated. To treat that infertility problem, we approach one kind of technology which is called assisted reproductive technology. What is meant by ART? Whatever medical procedures doctors use to address or treat the infertility. Simply to overcome the problem of infertility, doctors use certain kind of medical procedures. They are called ART. And also it is called treatments and procedures that aim to achieve pregnancy. The problems, the females with the problem of not conceiving are treated with some kind of treatments and procedures. They are called assisted reproductive technology. Here, different types of assisted reproductive technologies are presented in the form of chart. Just give a look at this one. Here, ART is of three types. One is in vitro fertilization, another one is artificial insemination, third one is surrogacy. Here, our discussion is about only artificial insemination and in vitro fertilization. Again, artificial insemination is of three kinds. One is intracervical insemination, second one intrauterine insemination, third one intratubal insemination. Let us discuss each one. The first one, artificial insemination. What is artificial insemination? The process of introducing the semen which is collected from the husband or healthy donor into the female body. Here, natural means is not practiced by the couple. Here, artificially, the healthy sperms are collected either from her husband or from other male who is healthy. The same sperms are injected into that female body who is unable to conceive naturally. Here, artificial insemination is of four types. The first one is intracervical insemination, second one intrauterine insemination, third one intratubal insemination, fourth one intravaginal insemination. What is insemination? Here, the releasing of the sperms into the female vaginal reproductive tract is called insemination. So, what is intracervical insemination? Here, the unwashed sperms are injected into the cervix region. This is the pictorial representation. So, this is the catheter used to inject the unwashed sperms into the cervical region of the female. This type of insemination is called intracervical insemination. Another type is intrauterine insemination. So, what does it mean? Here, the sperm or semen which is washed, injected into the or released into the uterus of the female with the help of catheter. This is the catheter. This injection contains unwashed semen or sperm. With the help of this injection catheter, the sperms are directly injected into the uterus of the female. This is the uterus region. Here the sperms are released artificially. It is called intrauterine insemination. The third one is intratubal insemination. Here, washed sperms are directly inserted or injected into the fallopian tube of the female reproductive system. Here, this is the picturization of the intratubal insemination. This is the catheter. With the help of this catheter, sperms are injected into the fallopian tube. Next, intravaginal insemination. Here, the sperms are injected into the vagina region of a female with the help of catheter. This is the pictorial representation of intravaginal insemination. These are the simple process to understand. Thank you for watching this video.